and thank you for joining part 2 of Seyfarth's micro-webinar series, Half an Hour for Healthcare, Helpful Hints for Healthcare Companies on California Wage and Hour Issues. This installment of the series will focus on the new minimum wage law. All participants are in listen-only mode. You are encouraged to submit questions throughout the program through the Q&A section located on the right side of your WebEx window. Any unanswered questions will be followed up by email after the webinar. For those interested in CLE credit, an attendance verification code will be read during the presentation. Please write this code down. It will not be repeated and is required for CLE credit. Copies of the webinar recording and materials will be distributed to attendees in the days following the webinar. At this time, I'd like to turn the program over to Andrew Paley and Parvafainia. You may begin.
Good morning or good afternoon, depending on what time zone you're in. Thank you for joining us. As Brooke mentioned, I am Andrew Paley. I'm the head of our California Wage and Hour Practice Group and one of the co-chairs of our national practice group. Today is the second session in our continuing series on wage and hour issues, specifically focused on the healthcare industry. Today, along with Par, who is up in our San Francisco office, we're going to be talking about the new minimum wage healthcare law, SB 525, that is slated currently, anyway, to take effect on June 1. More on that in a minute. And so real quickly, we're going to be talking a little bit about both the background of the bill, the scope of the bill, what the different minimum wage obligations are, and some considerations for employers in the healthcare industry in light of the new bill. So with that, and without any further ado, let me turn it over to Par, who is going to get us started on the substance.
Thanks so much, Andrew. So just to get us started, we'll go over the background and the scope of the law. And in terms of the background, this law, its basic stated purpose is to address the shortage of healthcare workers that we saw, following the start of the pandemic, and to create a more stable healthcare workforce. The California legislature passed SB 525 in September of 2023. It will raise the minimum wage differently depending on, the structure of an employer's business and the nature and size of the business. So there are actually 5 separate minimum wage schedules set forth in the law, and we'll be going over those in just a little bit. The bill is being codified as Labor Code sections 1182.14 and 1182.15, in case anyone wanted to look that up. And as Andrew mentioned, it's currently slated to go into effect June 1, but that may change. So recently there was a bill introduced, which is SB 828, and it's a last-minute bill that's meant to, delay the effective date by 1 month of the law. So it hasn't been passed yet. It's in committee right now. But the purpose of SB 828 is to align the law and the dates in the law with the budget year for the state of California. And we'll kind of go over that when we go over the minimum wage order. So we can go to the next slide. And with that, I'll turn it over to Andrew, who will talk a little bit about which employers are covered under this new law.
So to start with, this is an incredibly broad law in terms of the application of the scope. In brief, it's covering most employers in the healthcare industry, although not all. So the definition, while there's different definitions in section 1182.14 versus 1182.15, most of the covered employers are going to be found under the definition of 1182.14. And You can see on the screen the types of employers that are going to be covered by the bill. So without going through in painful detail here. So for example, under hospitals, we're talking about licensed general acute care hospitals, licensed acute psychiatric hospitals, specialty hospitals. For clinics, specialty care clinics, dialysis clinics, community clinics, psychology clinics, government-run clinics, rural health clinics, urgent care. List goes on. And again, if you fall, or you believe you fall within any of these categories, you can certainly reach out to us and we can have a conversation as to whether or not you fit within the definition or not. But the bill is intended by its scope to be very broad. And so if you fall within one of these topics here, more likely than not, you are going to be covered. Now, for certain employers in very, I would say, niche areas, they won't be covered. So, for example, hospitals owned or controlled or operated by the State Department of Hospitals, they're excluded. Tribal clinics are generally excluded. So if you've got, for example, an outpatient clinic operated by a federally recognized tribal organization, those types of facilities will be excluded, but otherwise the presumption is that you're going to be included if you fit within one of these definitions. Turning it back to Par to talk about one of the areas that has generated quite a bit of questions, which is what is an integrated healthcare delivery system?
Thanks, Andrew. Yes, there is a lot of confusion over what this term, integrated healthcare delivery systems, means. And if we go to the next slide, you'll see how the term is defined in SB 525. I'm not going to bore you all by reading through this prompt, but I will just say that, you know, there's no guidance given beyond this definition that you see on the screen over what an integrated healthcare delivery system is for the most part. There's a bit of a, I guess, an exception to that, which is to say that the government has released a list of the integrated healthcare delivery systems with 10,000 or more full-time equivalent employees. So great news for those who have 10,000 plus employees and are wondering whether or not they are an integrated healthcare delivery system. You don't really have to wonder. You can go look at the list, which was published by the HCAI, and we'll talk about that a little bit more further down the line in this presentation. But if for those who don't have 10,000 or more full-time equivalent employees, it kind of leaves a lot to be wondered about. And so, you know, again, no additional guidance beyond what you see in front of you, and it's a very fact-specific inquiry. As you can tell, it really has to do with, you know, the involvement of one hospital or more. That's easy. It's prong B of this test, so to speak, that is a little bit more complicated and nuanced, and it really just turns upon the relationship between the multiple entities that form this integrated healthcare delivery system. So if you have any questions, don't hesitate to reach out to Andrew or myself to talk through this test and see if you're covered. And with that, I think we can go to the next slide. So unfortunately, the breadth of this law is not just limited to how covered healthcare employer is defined. The term covered healthcare employee is, I would say, arguably even more broad. You know, it's defined to include any employee who provides patient care or, you know, or even supports the provision of healthcare. And as you'll see on the screen, that is defined quite broadly to include even gift shop workers, janitors, schedulers, billing personnel. You know, there's obvious categories covered, nurses and physicians. That's not going to surprise anyone, but I was pretty surprised to see gift shop workers were covered. So all that to say, when you're kind of assessing which of your employees, if you are a covered healthcare employer and you're assessing which of your employees are covered, generally take a broad approach to that because it's defined quite broadly. And it's defined so broadly that, you know, what makes this law quite interesting and puzzling is even if you yourself are not you don't fall under the definition of covered healthcare employer, that does not mean your employees are not covered. And that's because contracted and subcontracted employees can be covered. So if you have an employee that's placed somewhere else with a vendor you're working with, for instance, or you are the vendor and you're placing someone at a hospital, rather, they could potentially be covered, right? So the test for that is on the screen. So if someone is jointly employed by a covered healthcare facility, then they would be covered. But even if they are not jointly employed, such, you know, meaning that the healthcare employer doesn't, even if they don't control the employee's wages, hours, or working conditions, that employee could still be covered if they are contracted to work at a healthcare facility and they spend half or more of their time at that health facility. So again, it's an incredibly broad reach. So if you do the test and you determine that you are not a covered healthcare employer, keep going and, you know, make the assessment as to whether or not your employees are covered nevertheless. And on this topic, you know, we'll go through a few, you know, common questions that have come up here. So the first one is a little more basic, but, you know, if you have employees like in accounting or legal or marketing and advertising, for instance, would those employees be covered if you're a covered healthcare employer? The answer is yes. Again, like we recommend taking a pretty broad view of this definition and taking into consideration that anyone who, even if they indirectly support the provision of healthcare services, even if it seems removed, even if they're in some administrative building doing admin work, they will likely be covered. There are a few exceptions to coverage that are, you know, important to keep in mind. So for example, outside salespersons are not, they're carved out, so you wouldn't have to worry about outside salespeople. You know, there are other ones such as delivery or waste collection work. That is a potential exemption, and there are a few others, but overall, it's a pretty broad reach. And so to give another more, I guess, nuanced hypothetical, so let's assume that company X is a vendor for a hospital and that they supply the hospital with non-medical personnel who work on site. Let's say if these people who work on site are directly supervised by the hospital personnel and the hospital sets their schedules, they're covered, right? Also, even if if the hospital doesn't set their schedules, if they spend more than half of their time on the premises of the hospital providing services, even if they're not providing medical services directly, if they're supporting the provision of medical services indirectly, they would still be covered. So that's just a hypothetical to kind of illustrate how broad the reach is here. So with that, I will go ahead and turn it to Andrew, who will go over the minimum wage obligations under the law.
So and we can move to the next slide, thank you. So in terms of the actual minimum wage, there are a number of different categories. Technically, there's 5 as a practical matter, though it really devolves down into 4 different groups, and which one applies to you depends upon what type of facility you have. So, for example, Group 1, I kind of loosely refer to as the large healthcare system group. We're talking about facilities with 10,000 or more employees. And again, in terms of when this is going into effect, June 1, unless that gets continued, there is a bill currently pending that would push this out by 1 month. That bill's still in committee, so there's really not a lot to say about it. From what we understand, the potential delay is a factor of the state ironically not being in a position to comply with regard to its own hospitals, and so they may be looking for another month. But like I said, that's still in committee. So at this point, I think you have to assume that we're going live on June 1 until being told otherwise. But you're looking at $23 an hour in terms of the baseline for June 1 through May 31 of 2025. And then it escalates thereafter. And again, there are different groups. The slides will show the different rates for the different groups. One of the things that is important to understand is that after 2027, it doesn't stop. There is built into the statute an automatic increase. The director of finance is supposed to be calculating the new minimum wage that will apply using a 3.5% increase based upon the consumer price index, or whichever is lower in terms of the average. So just when you're looking at the slides, understand it's not that the rates stop in 2027. They continue. It's just going to be based upon a formula. One thing that is worth also noting is that with regard to certain of the groups, you'll see that in the definition, it talks about healthcare facilities that are owned, affiliated, operated by a county of a certain percentage. And questions that we have been getting is, well, what does affiliated mean? And the answer, unfortunately, is there's no clarity in the statute. And so a lot of this is still going to have to be worked out. But if you are contracting with a government agency, it's a pretty good bet that you're going to be covered under one of those groups. So I will move it back. Well, let's move to the next slide just so that people can see the other minimum wage for the for groups 3 and 4. Brooke, next slide. So here you'll see group 3, primary care, free clinics. Group 4 is sort of a catch-all. So if you're not fitting within groups 1 through 3, you will otherwise still fall within group 4 if you are a covered employer. And so the minimum wage for you would be moving up to $21 as opposed to $23, for example, if you are an employer that has more than 10,000 covered employees. Turning it back over to Par to walk us through some of the challenges and implications for employers.
Thanks, Andrew. So a few considerations in terms of compliance that we want to flag. The first one is that, you have to keep in mind that this doesn't just apply to non-exempt employees. It'll apply to exempt employees, and if you have any salary non-exempt employees, them too. But, just keep in mind that salary adjustments will have to be made for the exempt employees that you have to make sure that they are also being paid in accordance with the law. And then another big implication that we wanted to flag is for those of you who have employees that are covered by a CBA. As many of you know, there are certain exemptions, CBA exemptions under the California Labor Code, such as the one set forth in Labor Code Section 512 or 514, that basically, provide for certain exemptions from the Labor Code requirements for folks covered by a CBA if certain requirements are met, and one of those requirements is that their pay be 130% of the applicable minimum wage. And so for all intents and purposes, that's going to be this new minimum wage, right? So keeping an eye on that, looking at your CBAs, and making any adjustments that need to be made. And then, we've already talked about the possibility of the delay in enactment. That's SB 828. One thing I didn't mention earlier is that the committee is actually, they had a hearing this morning, so, pretty soon we'll see where this is headed, but right now it has yet to be passed. And then the last thing in terms of compliance consideration is the waiver program. And the waiver program will apply, or folks that may be eligible to apply for the waiver program are the employees that fall within Group 3. So the thing about that is the DIR, and I saw this in a comment we received during the presentation. The DIR is supposed to, publish some regulations or some, information regarding this waiver program, and they were supposed to do so by March 1st of 2024. But as the person who commented noted, they haven't done that. And actually, it's not the only resource that was promised under SB 525 that wasn't published on time. And so, that was kind of the first bit of writing on the wall for us in terms of, a possible delay being flagged when we noticed that these resources that were supposed to be released by certain dates were not being released. So keep an eye out on the waiver program if you think it's applicable. There are certain requirements that have to be met. And again, you'd have to fall within Group 3. And, if you have any questions, let us know, but we'll keep an eye out on that, additional guidance that the state is supposed to release, and we'll provide an update when that happens. In terms of other considerations to keep in mind, if we go to the next slide, and I mentioned this just now, but basically there are certain resources that were promised under SB 525, some of which are not currently available, some of which are. The big one that is available is the list of covered healthcare facility employers or integrated healthcare delivery systems with 10,000 or more full-time equivalent of employees. So that list is available. It was published by the HCAI. So we recommend checking that out if you have 10,000 or more employees and you're wondering if you're covered. And then beyond that, there's also a list that's been published of all hospitals that qualify as a hospital with a high governmental payer mix, independent hospitals with an elevated governmental payer list, or rural independent covered healthcare facilities. And that list was also, actually, I think it's one list that includes the 10,000 plus employees, and then has this second piece to it. It's all one document published by the HCAI. And then another consideration is preemption. So the bit of good news that comes with this new law is that there are limits to what local, counties, cities, and the like, charter cities, can do in terms of enacting another ordinance related to wages for covered healthcare employees specifically before January 1st of 2034. So, the government is trying to make it so it's not a situation where you have to worry about all these different minimum wages in all these different areas to keep up with. Of course, if a municipality wanted to raise the minimum wage across the board, they could still do that, but this limits what they can do in terms of a healthcare specific raising the minimum wage. So that's some good news. And the other component, the other consideration to keep in mind is that there is a private right of action under SB 525. So folks will be able to enforce their rights by filing lawsuits and, pursuing litigation, which is an important factor, we think, to keep in mind. And wow, I can't believe, I think that's our presentation.
I think we've got one or two questions that we can probably touch on. We have a question here. Oh, I'm sorry. Did you read the CLE code already, Par?
No, not yet, but we can address questions first.
Yeah, so real quickly, I think we'll just have time to just touch on one or maybe two. But one of the questions we received is with regard to physician groups with fewer than 25. physicians. Due to lobbying, if you have a physician group with fewer than 25 physicians, they are the bill was amended to exempt those practices, and leave. Let's take a quick look. I think we can probably hit one more. There was a question about pharmacies, and yes, as a general proposition, they're going to be covered. Pharmacy workers, again, the scope is extremely broad. So as Par was mentioning, if you're looking at, for example, in a hospital, even gift shop workers are covered by the ambit. And so the law is does not apply to just frontline medical providers. It's quite broad in terms of its application if you're a covered employer.
But to that point, Andrew, one of the questions, we got a few questions on the pharmacy front. The second question we got on pharmacies is, what if it's a standalone pharmacy? There's no hospital, no involved. And in that instance, absent the, again, like the assessment as to whether you are a covered employer versus whether your employees are covered, those are two different considerations, right? But that, the standalone pharmacy, and Andrew, you can tell me if you think I'm wrong on this, that would not be covered as a covered healthcare employer. So with that, I think, I don't know, Andrew, do you think we have time for more questions, or should I go ahead and give the?
So we did get a question with regard to remote employees, an interesting one, which is if your employees are remote, they don't work on site at, for example, a hospital, and they're outside of the state of California, does the law apply? And the answer there is California minimum wage law, whether it's this bill or any other bill, in fact, California labor law, applies to employees in the state of California. So if you have, let's say you contract with a hospital and you have some employees who support the operations and they're based in Florida, California minimum wage law does not apply to employees who reside outside of the state of California. So we're talking about people in the state of California.
That's right. And I see that we've gotten a lot of thoughtful questions. Unfortunately, we're not going to be able to address them all on this webinar because we're running out of time, and I still have to announce the CLE code. But I think we'll see these questions afterwards, and we can certainly circle back, or feel free to reach out to us directly with your questions. But with that, I want to make sure I give the CLE code with time to spare. So the CLE code, and I will announce this twice, is SS7156. So that is SS7156, and the S is as in Seyfarth Shaw. So with that, we thank you all so much for your time today. Thank you for joining us. And again, don't hesitate to reach out if you have any questions.